Welcome to the Explainer. So today we're looking at something you use, probably over 20,000 times a day without even thinking about it. We're exploring the anatomy of the thoracic wall. But listen, I don't want you to just think of this as some dry list of bones and muscles. Think of your chest wall as a dynamic, moving biological house. It's an absolute structural masterpiece that literally keeps us alive, constantly expanding and contracting to pull life-giving air into our lungs. Okay, let's dive right into this. Right now, wherever you're sitting, standing, whatever, just take a deep breath in, hold it for just a sec, and let it out. What you just felt, that was this majestic structure right here in action. What we're looking at is the thoracic cavity or chest cavity, which houses and fiercely protects your heart and lungs. It is an incredibly complex, living, breathing room, and we are going to completely deconstruct it today. Here is our blueprint for the explainer. First, we'll be mapping the chest cavity. 2, looking at the architecture of the ribs. 3, the mechanics of breathing. 4, diaphragm, the breathing engine. And finally, 5, wiring and plumbing. All right, section 1, mapping the chest cavity, boundaries of the biological room. You know, the thoracic cavity is actually the second largest hollow space in the human body. And interestingly, it varies a lot in size from person to person, usually a bit larger in males than in females. Now, to really map this space, we first got to find its roof and its floor. The roof of our biological house, scientifically known as the thoracic inlet or the superior thoracic aperture, has very specific bony boundaries. Notice the T1 vertebra in the back, the first rib on the sides, and the manubrium, that's the top part of your sternum, right in the front. This opening is absolutely crucial. It's the gateway transmitting the esophagus, the trachea, the very tops of your lungs, and all those major vessels and nerves passing back and forth between your neck and your thorax. Now contrast that with the floor of the cavity, called the thoracic outlet or inferior thoracic aperture. This opening is way wider. It's bounded at the back by the T12 vertebra, on the sides by the 12th ribs, and at the front by the xiphisternum, right down at the bottom of the breastbone. And what's honestly wild is that this massive opening isn't just some empty hole, it is entirely filled and sealed off by the diaphragm, completely separating the chest from the abdomen below. Moving on to section 2, architecture of the ribs, the protective frame. Just like any house needs wooden or steel studs, our biological room relies on a super strong yet flexible bony cage of 12 rib pairs, and this brilliantly illustrates the difference between them. A typical rib, think ribs 3 through 9, has a distinct head with demifacets to articulate with the vertebrae, a neck, a tubercle to lock into the transverse process, and this long, curving shaft with a costal groove. But atypical ribs, they completely break the mold. The first rib is incredibly short, wide, and flat. Then you've got ribs 11 and 12 way down at the bottom, which literally don't attach to the sternum at all. We call them floating ribs, which honestly sounds a bit like a magic trick, but it's actually nature's genius way of protecting your lower organs without ruining your ability to twist and bend. Which brings us to section 3, the mechanics of breathing, walls that move. So we have our bony frame, but unlike a brick and mortar house, our thoracic walls are totally dynamic. Filling the 11 pairs of spaces between our ribs are 3 distinct layers of highly specialized intercostal muscles. Step 1 is the outermost layer, the external intercostals. Step 2 is the middle layer, the internal intercostals. And step 3 is the deepest layer, the innermost intercostals. What's so elegant about this biological engineering is the fiber orientation. The external and internal muscle fibers lie at perfect right angles to each other, forming this incredibly strong crosshatched muscular wall right between the ribs. Let's see how these muscles actually act during the breathing cycle. Inspiration, breathing in, well, that's an active process. Your external intercostals contract to physically pull the rib cage up and open, increasing the width of the cavity. But what about breathing out? It's kind of crazy to think about, but everyday quiet expiration is a completely passive process. You just relax, and the passive elastic recoil of your lungs and rib cage does all the heavy lifting to push the air out. Physics literally breathes out for you. You only recruit expiratory muscles, like your abdominals or lateral internal intercostals, for active, forced breathing, like, when you're hitting the gym or coughing. Section 4, diaphragm, the breathing engine. We've talked a lot about the walls expanding, but the real horsepower of breathing, that comes from the floor. The diaphragm is the largest and arguably most important inspiratory muscle in the human body. Now, what's really interesting about this is how much this muscle physically moves to keep us going. It forms the inferior boundary of the thorax, creating two big domes, naturally rising a bit higher on the right side, mostly because your liver is tucked right underneath it. When you breathe quietly, it descends about 2 centimeters, acting like a piston pulling air into the lungs. But when you take a really deep breath, that excursion shoots all the way up to 7 centimeters. That massive drop in the floor creates a powerful vacuum that rushes life-saving oxygen straight into your system. But remember, this moving floor tightly seals the chest from the abdomen, so major vessels still need a way to pass between them without blowing that pressure seal. To solve this, the diaphragm has a series of specific apertures, or trapdoors, to let these vital structures sneak through. You've got the vena cava foramen at the level of the T8 vertebra for the inferior vena cava. Then there's the esophageal hiatus at T10. And finally, the aortic hiatus at T12, allowing the massive aorta to descend safely into the abdomen. It's just brilliant plumbing. And speaking of plumbing, let's hit section 5, wiring and plumbing, blood supply and nerves. Every biological house needs a power grid and a water main, right? It needs to deliver nutrients and electrical signals to all those incredible muscles we just covered. So the crucial point here is understanding the neurovascular bundle. Hidden inside every single intercostal space between the ribs, there's an essential group containing an intercostal vein, an artery, and a nerve. And the coolest part is they are always structured in a perfectly predictable order from top to bottom, or superior to inferior. Look closely at this cross-section of a rib, and you can see exactly where this bundle lives. It rests safely nestled within the costal groove, right on the underside of each rib. This little bony overhang protects the delicate vessels from getting banged up. And that structural order, from superior to inferior, it's vein, artery, nerve. V-A-N. Van. Because of this beautifully consistent engineering, if a medical professional ever needs to insert a needle into the chest wall, they will always aim just above the lower rib, using that upper border for clearance. That completely avoids hitting the delicate van bundle hanging right under the rib above it. Now, the arterial plumbing of the thoracic wall is essentially a highly efficient dual feed system. At the front, the anterior intercostal arteries for spaces 1 through 6 originate directly from the internal thoracic artery, which is a branch of the subclavian artery running right down the inside of your sternum. Spaces 7 to 9, those come from its terminal branch, the musculophrenic artery. Meanwhile, the back of the house is supplied by the posterior intercostal arteries, and those mostly branch directly off the massive descending thoracic aorta. Of course, after dropping off oxygen, that blood has to drain back to the heart. This is handled incredibly gracefully by the azygous venous system. Notice how it's beautifully and asymmetrically anchored, tucked safely against your vertebrae right along the spine. The posterior intercostal veins drain, directly or indirectly, into the azygous vein on the right side of the vertebral column, while over on the left side, they drain into the hemiazygous and accessory hemiazygous veins. To wrap up our wiring, let's look at the autonomic nervous system. The thoracic sympathetic trunk is basically a chain of ganglia that literally lies over the heads of the ribs at the very back of the thoracic cavity. White and gray rami communicants connect the sympathetic trunk right to the spinal nerves. And notably, branches from the upper T1 through T6 ganglia don't just supply the chest wall. They actually extend outward to innervate the whole thorax, and even the heart itself. So we've covered the boundaries, the bony frame, the muscular walls, the engine, and the intricate wiring and plumbing that power the whole shebang. Just think about how perfectly synchronized these distinct systems have to be for you to simply exist. Take one final, very deep breath in. Can you feel your biological house in action? Next time you take a breath, which, let's face it, you usually don't even think about, remember this invisible structural masterpiece working tirelessly inside you. Keep exploring, keep learning, and I'll catch you on the next explainer.